Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered and unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
And I'm Dr. Shala Mokbel.
And today we have a very interesting topic. We are going to be talking about AI and the growing role of AI in medicine. We're going to be talking about topics such as improving efficiency and what impact it'll have on our jobs, on patients' trust, and ultimately the ethical concerns around AI. So, Shala, have you already started using AI in any of your jobs, or is it something that you've just kind of heard about? I'll tell you for myself, I'm hearing so much about it, but I personally, I feel like I don't know too much about what's going on.
I'm kind of using it and not using it. It's hard to answer that question because I'm sure we all started using ChatGPT in some aspect of our work. So, for example, sometimes if I have a complex patient, I do search, I give the symptom and say, this is the duration of the symptom. What do you think? And it gives me a general idea of what to look for. And I still have to filter those answers, though. Use my clinical judgment, of course. Some of the results are relevant, but some are not relevant. So it helps a bit, but it really, it needs, again, my clinical judgment to fit it to the individual patients or personalize it even more.
So I feel like I use ChatGPT as well, but I think I use it more for spelling and grammar purposes. Like if you're going to type something up, not necessarily even in a patient chart, but if you have a really long assessment and plan or something that you want to type up, I sometimes put it into ChatGPT and see if it can be written in a more concise manner. With that said, I don't know if that's necessarily making me more efficient because now I have to put it down and then put it into ChatGPT and then like go back. So I don't know. I feel like right now, if the promise is AI is going to make things more efficient, I'm not sure if I'm using it to its highest potential, I guess.
Yeah, definitely. I've used it that way too, in some of the intakes, for example, to make the sentences grammatically nicer, concise, as you said. So, yeah, I definitely use it that way. But the hope is that we don't have to copy paste it, right, into ChatGPT or in any other AI tools, and it would be just automatically integrated into the EHR. And we can talk about some of these tools that have developed over the decade. I don't know if you remember, but back in the days even when I was in medical school, we used papers, right, for everything. We used paper charts. We used even EEGs. I remember there were records of EEGs on papers, evoked potentials, that I do IOM. They were on papers. I can't even believe how we did it. I remember labs were in papers. You would fax the request for labs to the lab. Everything was on paper. But over the past decades, these tools developed, not necessarily AI, but for example, the electronic medical records, electronic health records developed. And the goal was to make it easier for the physicians, to make this work more efficient. But what do you think about that? Do you think that we became more efficient with those tools, or what is the pros and cons of those?
I mean, just going back to what you said earlier, AI, I feel like a lot of people are kind of hesitant about it. They're a little careful about it. But realistically, there's been evolution of medical tools over the past like 50 years. So even though AI is a new technology or a new form of technology, I don't necessarily know if we need to be like scared of it. Like you highlighted, we went from paper to digital records. And I feel like that happened really quickly because when I was doing rotations as a medical student, there were some hospitals that were all chart notes. I don't even know how they did it because half the time you can't even read what the doctor wrote. So I think shifting to an electronic health record had its pros and cons. I think the definite pro is now you can actually read. You can do, or
Prescriptions.
going back, yeah, you can read. You can do electronic prescriptions. You actually know what the doctor is asking for. The nurses are able to see the orders that are placed. So I think all of those things are positive because even in some of the hospitals that I was rotating in that had EHRs, when EHR is down or is not working for like the morning, it's all like paper orders, which I don't even know what they did like in the setting of lawsuits back in the day. Like, how can you prove that something was ordered at a certain time, right? So I think EHR has been good for that. I think EHR has also been good for patients to be able to obtain medical records. Like you and I have been patients before. If we want our medical record, we can log in and get it ourselves. So in one way that's good. In another way, I feel like gives the patient too much information. And I'm not saying patients should not have their information, but now you have Epic Chat where they can send messages directly. So it went from like limited communication to now the pendulum has swung all the way in the other direction. And with that comes more discretion at billing, right? Because back when there was paper charts, I don't even know what the billing departments were doing. I know there definitely were not that many administrators involved, right? So now you have more administrators patrolling what we're doing. And I think that's kind of been part of the increased administrative burden and decreased physician pay over time. So I guess that's the long answer to your question, like the pros and cons of what I feel like we've had. But the diagnostic tools, like now we can just go in to the Epic or whatever your EHR is. You can access like the EEG reports. You can access the actual raw EEG. You can access like the brain imaging. Whereas back in the day, I think you had to like actually pick it up and put it up and try to interpret it yourself. So it's definitely made things easier and more efficient. But I think it's also created some problems in terms of increasing administrative burden for physicians.
The other one was this decision support systems were created or integrated into the EHRs, in the 1980s and 1990s, where providers get alerts for drug-drug interaction warnings or reminder checks for certain tests and labs. While this helped the doctor, but I can see it becoming kind of an alert fatigue, right? You just like, how many times have you looked at an alert and it's like, okay, this alert, so overwhelmed with work that you don't even read the alert anymore, right? You just click on it and move forward. While technology, and these are not necessarily AI, but these were just tools, technological tools that were developed over the past few decades to help the physicians. While they were very important and did make our work more efficient, but also added a lot of administrative burden and took away something else, right? Took away a human aspect, which was basically spending time more with the patient and writing your note in a few sentences. How many times have we seen, colleagues that write pages and pages of notes, right? And it is for good reason. It's becoming defensive medicine to be able to document in a way that you can, support your case just in case, something happens. But a lot of time it becomes templates and we use notes that are just pages and pages of notes compared to a one-page note that the physician was writing in the past, scribbling something and spending the majority of the time with the patient.
Like I said, I think the pendulum swung in the other direction completely because what we had before was not ideal either. I think the paper notes, the bad writing, the very short notes, all of those I don't think were ideal in patient care, but physicians at least had the time to spend with patients, which I think patients, if you ask them now, they'll kind of reflect back on that and say, oh, yeah, doctors back in the day used to be more present, XYZ. But now we're so consumed with documentation and we're on our computer that we literally see patients for, if you're inpatient, you're documenting more than you're seeing patients, 100%. So, yeah, I think the pendulum swung all the way in the other direction.
Santoshi, what is AI in medicine nowadays? What do you think? How is it different from those tools in the past?
I think AI is a broad-based term, right? Well, not everyone knows what people are talking about, and I'll be honest, I think I have a lot of learning to do as well. But in my experience and in the research that I've done for our podcast, is there's three different types of AI that the companies are currently working on to help make the healthcare system maybe more efficient, maybe more easily flowing for both the physician and the patient. One is machine learning. So, machine learning is a type of artificial intelligence where computers learn from data patterns without being programmed. So, basically, they'll take large data sets like medical images or patient records, and they can try to predict disease risk, like risk stratification. They can identify trends, maybe recommend treatments. So, those kinds of things, I think people are working on, scientists are working on to have physicians have that tool stratify risk factors. Like, for instance, if we see someone who comes in with a TIA, we'll be able to accurately predict like their risk for a stroke instead of having to plug everything into MD Calc or the current calculators we're currently using. So that could be helpful, I think. The next one is natural language processing. This is where computers try to understand and interpret what human language is being said and written. And NLP, or natural language processing, they think can extract information from doctors' notes, medical literature, or patient communications and help automate documentation. So, for instance, one of the hospitals I'm working at is coming up with an AI scribe, where it's an AI device. You can just dictate into it, and it will come up with meaningful assessments and plans for the patients, which is kind of interesting. And they're hoping by doing this, they can also streamline coding and billing, because now you're saying everything that needs to be said to bill or code a certain way. And that will take some of the the work from the physician by making it easy, because right now if we don't code or bill a certain way, we'll get nasty emails from the billing department saying, hey, you have to document this, you have to document that. So they're hoping this will make it easier and also improve the clinical decision making process. And then lastly, we have computer vision. Computer vision helps us interpret and analyze visual data like images or videos. This is, I think, the one thing that people say when AI is going to replace radiologists or EEG techs, or not EEG techs, I'm sorry, EEG readers, things like that, where X-rays, CT scans, and MRIs will be read by AI, so there's no need for a physician to read it. Now, is that something that I think is possible? We'll talk later in this episode if AI will actually replace physicians, but I think that's one of the things that I've heard a lot about.
And I think it's important to understand the difference between this one and the tools that were developed in the past. The difference is that artificial intelligence, or AI, has the ability to learn from its mistakes, from the errors. Okay, so it doesn't follow fixed rules, like the alerts that are integrated into the EHR in the past that helped with the drug-drug interaction. For example, if an AI is integrated to help with the drug-drug interaction, it will learn the allergy for that drug-drug interaction, or what happened during that drug-drug interaction for a specific patient, and it will individualize it, and it will not repeat that for others. So you will not be able to ever do that, for another patient of the same allergy or the same, drugs. So the so it's very different than the tools that we were using before, where it was just fixed rules. The physicians or the APPs have to basically kind of individualize it based on the patient. So this is very different. AI is actually recognizing pattern and can have the ability to read the images. So it's very, very different than the tools that were developed in the past decades.
So let's talk a little bit about the benefits and the risks and challenges. I mean, we've already touched a little bit on the benefits and the risks, but I think one of the benefits of AI is it can reduce documentation time for the physicians, freeing the doctors for more patient interaction, which I think can be helpful because, like you said, with the drug-drug interactions, how often are we seeing patients where it says they're allergic to something? You don't know what the heck they're allergic to or what the allergy is. The patient doesn't know either. So now you're like trying to call family or trying to call the pharmacy. Whereas if AI gets involved, all of that stuff will be kept track. So whenever they had that allergy, like, I don't know, a year or two ago, it can go back into the chart and see exactly what happened or what the documentation was. So it'll be right there in front of you. So you don't have to go around in circles trying to figure it out. Medication reconciliation is another one. How many times do we see patients who don't know what they're taking? Well, I think one of the benefits from AI is it could probably be synced to a patient's pharmacy. So it can tell you exactly what they filled, when they filled it. So those kinds of things I think would be helpful in reducing documentation time. Also, the AI scribes I think would be kind of cool, because someone, you can talk into a mic like I'm doing, and it might just come up with a really nicely worded, accurate assessment and plan. So that's kind of nice. Um, Next, I think one of the benefits would be accuracy and speed, an increase in accuracy and speed. So earlier diagnosis and interventions, and patients who are having strokes, for example, when they come in within TPA time, if the EMT, for example, is able to get that information very quickly from the patient, I think that can be synthesized to the receiving physician, and then they'll know quickly if that person is a TPA or a TNK candidate. So I think that'd be helpful in terms of improving speed. Accuracy, things like if an AI is able to read MRIs quicker than a radiologist, and can sensitively detect abnormalities like tumors, I mean, cancer detection, the accuracy can improve. So, those are, I think, some of the key things.
For inpatient, it would be good to have a tool to triage like which patients are sicker, and then go based on that and seeing those patients. But also then, it comes to the question of the risks that comes with it. Is there a bias in the algorithms? For example, how can we rely on it? Is it really reliable for example, for triaging or for stroke patients? So, and we can talk about some of the risk and challenges of AI. Some things that I can think about, one was the bias in algorithms that we talk about, disparities. Does it take health disparities into account when algorithms are developed, in the first place? I don't know. I'm not sure if that happens. The other one is a data privacy, of course. Now in the era of everything is digitalized. So there's a huge risk of data breaches, HIPAA violations, HIPAA considerations. Does the patient trust AI, and then over reliance on technology? I don't know about you, but when I have the GPS on, I don't know, I'm not paying attention to where I'm going, just following directions of GPS. Even if it takes me to the ocean, like inside the water, I just follow it. It's crazy to me that how even in my neighborhood, like I don't know my neighborhood very well because I'm now over relying on the GPS, on this technology, and just putting it. So the question is, will this happen to doctors? Will we be over relying on AI where we're not using our clinical judgments anymore?
AI can come up with tailored treatment plans for your patient because it knows the whole patient history without you having to input it, since it has access to the whole chart. But on the flip side, that also affects data privacy, like you said, patient trust and HIPAA considerations. If this technology has access to the entire patient chart where it can come up with tailored treatment plans, what's keeping it from not being hacked? Cybersecurity then becomes an issue. And so, how secure is that data that it has access to? One thing I think we did not talk about that would be helpful for AI is access to rural and underserved areas. I mean, we're already seeing a lot of telemedicine. I think telemedicine and AI tools will continue to grow. But on the flip side, you and I have had experience with telemedicine. It's not that easy, and not everyone is a telemedicine candidate. So that leads us to who is going to be responsible if something bad happens, right? Like you said, we are going to be really dependent on this technology in many ways. It's going to be making plans for us, assessments for us. We're going to be seeing people over camera. Okay, all of that is well and good. But if something goes wrong with the patient, when there's a legal challenge, if AI makes a mistake, is it still the clinician who's responsible? I think so. I think it'll end up coming on to us, which is actually kind of scary because now we're going to be expected to work more efficiently because hey, you have AI, but who is regulating that AI, right? And if you really want AI to replace physicians and nurses, which by the way, I don't think is going to happen, but we'll talk about that more. But if we're really trying to replace healthcare workers with AI, what happens when there's a bad outcome? Like who's going to be held liable?
I think one analogy to that is when physicians started having APPs, right? I mean, there were, and they had to co-sign all the APPs notes. How many times have you heard that a physician said that I haven't even looked at the APPs, assessment and plan, and I didn't even discuss the case with them, and they just co-sign, right? And then when something bad happens or there's a bad outcome, then it's still on the physician, correct? Because ultimately they put their signatures on it. So I feel that this is going to be kind of similar to that. And we have AI, basically artificial intelligence, is helping with lots of the clinical decision making. But ultimately, I think the regulations and the legal challenges will still lie on the physicians at the end of the day. So now, when you have physicians that are responsible for like 10 to 15 patients a day, then they'll be responsible for more patients uh, with the help of AI. That's what I think is going to happen.
It's going to be interesting what happens in terms of the future of AI, how compensation will change for physicians, potential risks and challenges. And I think all of those things we can save for a next episode. But I think we should close out this episode in talking about how we think AI will change the overall doctor patient relationship. I don't think AI will improve that relationship, quite frankly. I think we're already very reliant on technology. Like you said, I mean, you know this, when my phone broke at work the other day, like my whole world came crashing down. Like I had to quickly go replace it. Like, why is that a thing? Like, why am I so reliant on my phone? Now, imagine we're that reliant on a technology or a piece of hardware for really, really important decisions. It holds all of our personal information. What if it crashes one day? What happens? Doctors start relying more on AI. I have a feeling that there's going to be some depersonalization. They're going to rely so heavily on AI that they will have trouble making that human connection, or they just won't have time for it. Because again, if there's anything that I've learned in the past, the more efficient you are, the more efficient they want you to be. So if you see more and more patients and you're getting good at that technology, oh great. So now you can see 40 to 50 patients a day, right? Because you have AI helping you. So I don't know. And I don't know how we can maintain the public trust if that's where it ends up being. So personally, I don't think it's going to change for the better.
Completely agree with all those points. The more you strive, the more it's expected. I really think that with every piece of technology, a human aspect is gone. So, for example, when we started having communication through emails or communication through texting, like how many times now we call each other, right, to talk to hear each other's voice? We don't anymore, right? We just use text messages. So again, that human interaction was lost. Okay, or as I said, the example of GPS. When you go to the car, the first thing you do, you put a destination in the GPS and you just follow directions. If the GPS is broken, you can't get to that point. I mean, I was thinking to myself, how did I even go to work using maps? But when I used maps, I used the maps one day. And that's it. The next day, I was able to go to work by myself without using anything. But now I use GPS every single day. And if it's broken, I can't go to work. It's just, I got lost.
It's
So,
almost like you get dumber. Like it's not,
exactly.
it's counterintuitive. AI is supposed to make you smarter, or technology is supposed to make you smarter, but I think it almost puts your brain on like autopilot.
Hibernate, right? Yeah.
Yeah, exactly.
Yeah, it's just so I'm worried about that. I'm worried that our clinical skills will be lost. I'm worried that our clinical judgment will be lost because now we're going to rely on all these, tools to help. And then on the other hand, and we will talk about this uh, on the next episode, because I know there's a lot to talk about for AI, the compensation. What will the compensation landscape be for physicians, in the future? Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.